What is CF carrier status in newborn screening? Imagine a tiny baby being tested for something they might not even show signs of yet. When newborn screening for cystic fibrosis is done, one important result is whether the baby is a carrier of the CF gene. Being a carrier means the baby has inherited one normal copy of the CFTR gene and one mutated copy. The CFTR gene is responsible for controlling salt and water movement in the body, especially in the lungs and digestive system. If a baby is a carrier, they do not have cystic fibrosis and will not develop the disease. They usually look and feel healthy. The screening process starts with a simple blood test taken a few days after birth. This test measures a substance called immunoreactive trypsinogen, or IRT. Babies with cystic fibrosis tend to have higher levels of IRT. If the IRT level is elevated, the next step is genetic testing. This involves analyzing the baby's DNA for common mutations in the CFTR gene. If at least one mutation is found, the result is called screen positive. But this does not mean the baby definitely has cystic fibrosis. It means further testing is needed to find out. Most babies with a positive screening do not have cystic fibrosis. About 90% of these results turn out to be false positives for the disease but true positives for being a carrier. To confirm if the baby has cystic fibrosis or is just a carrier, a sweat chloride test is performed. This test measures the amount of salt in the sweat. Babies with cystic fibrosis usually have high salt levels, but carriers typically have normal sweat test results. Being a carrier means the baby has one functioning CFTR gene and one mutated gene. Carriers do not experience symptoms of cystic fibrosis. However, knowing carrier status is important because, if both parents are carriers, there is a 1 in 4 chance with each pregnancy that their child will inherit two mutated genes and develop cystic fibrosis. This information helps families understand their genetic risks and plan for the future. Parents of carrier babies are often offered genetic counseling. This helps them learn about their own carrier status and the chances of passing it on to future children. It also provides options for family planning, such as testing other family members or considering reproductive choices. Early identification of carrier status through newborn screening supports informed decisions and helps prepare families for any potential health considerations. In summary, CF carrier status in newborn screening means the baby carries one normal and one mutated CFTR gene. It is detected through a 2-step process involving blood tests measuring IRT and genetic analysis, followed by a sweat chloride test for confirmation. This information is valuable for families to understand genetic risks and make informed choices about their health and future. Always remember to consult healthcare professionals for personalized advice and further testing if needed.